Hi, my name is John, and this video I put together to help me get through EMT Basic, and I thought I'd share it with you because if you're anything like me, you're probably struggling with the amount of material and the terminology and all the crazy things that you need to know in order to effectively take care of another human life. So with that, let's jump into this. I want to start out with a quick disclaimer. First of all, I'm not an EMT instructor, and I'm not a clinician. I'm not a doctor, nurse, or anyone like that. The information I'm presenting to you here, I'm just doing as is. I'm not telling you that you're going to pass any test or that you should even consider this to be correct. So if there's any liability for this, it's on you. You ultimately are the one responsible for the accuracy of this information. And so keep in mind that your success as an EMT is solely your responsibility. So please, please, please make sure that if you read something in your textbooks or if you're told something by your instructors that is different than what is presented in this video, you should always follow the textbook as well as your instructor, your medical director, medical control, your state agencies, and pretty much everybody other than me. But importantly, please make sure that you take time to confirm what I'm telling you is accurate. Okay, with that disclaimer out of the way, let's jump into this and just talk a little bit about what we're covering in this module. So I want you to first and foremost understand there are basically three things you need to know as to why you need to understand airway management. And we're going to build off of this. Everything in this module is designed so that we lay a foundation and we keep building on it. Now, this is what works for me. I found that maybe not going in the exact order of the textbooks that we use in the EMT classes is the most manageable for me. And so I've kind of changed the order around a little bit to help me kind of get my head around the material, and hopefully this works for you. So if you're trying to follow along in a textbook, you may find that you have to jump back and forth from different sections, but I think it will help you absorb the material much better. So it's important to understand that ultimately, as an EMT, helping somebody breathe better, as any clinician actually, the ability for somebody to breathe adequately is one of the most critical things you need to be able to do for someone. And in order for somebody to be breathing adequately, you have to be able to assure that oxygen is delivered to the tissues and cells of the body. This is completely, fundamental, right, to all human processes. So if we're not doing that, then we're going to have an issue with the body functioning. And that's going to be the foundation of everything else in the EMT program and pretty much any other program that you go through in part of your EMS training. It's going to come back to how well is the body delivering oxygen to tissues and cells. The way this occurs is through the action of breathing and circulation. So if you can keep that in your mind that, okay, in order for us to provide oxygen to tissues and cells effectively, we have to have effective breathing and circulation. Everything else we're going to learn here is going to build on that concept. So that's why it's important that you kind of understand why you're learning this, is so ultimately we can recognize issues, challenges related to breathing, which typically are going to be because oxygen isn't being delivered to tissues and cells, and that could be a result of some type of problem with breathing and circulation. Okay, so with that foundation, and please understand that if you're just like overwhelmed, I'm going to break all this down. We're going to really take this in bite-sized pieces, and you can obviously pause the video and go check the textbook, look something up. In fact, I'm going to start with everything you need to know to hopefully get through this section of your EMT training program. Now, I'm not going to go through each one of these. I am going to tell you that anything with a check mark is something we're going to cover either in this video or part 2 of this program, of this video series. Anything that's got a little box next to it is something you either need to learn in class through your instructors or you need to study through your book or both. So please take a moment, because one thing you can do is use this as a way to check your level of knowledge and how well prepared you are to take the written exam and ultimately your skills exam. So here's part 2 of that. And again, anything with a check mark we're going to cover at some point in time. And you can keep me honest by checking to make sure I did review this. But for right now, let's move on. Again, you can pause the video and look at this list on your own. So I want to take a moment and get your mind right about what you're about to learn. Because a lot of times I think when we're talking about this stuff, it's overwhelming, especially if you're doing a hybrid program and it's all being thrown at you and you have very quick, short timelines of that you have to be prepared and come up to speed on things. But this is really the start of the good stuff. Prior to this, you probably did a lot of things with medical legal and wellness. You probably got into patient lifting and the basics of human anatomy. But this is really the cool stuff. This is where we start to become, masters of our craft, so to say, right? We're taking the first step on that journey to mastering our craft as emergency medical services personnel. So this is kind of cool, right? This is the stuff we're going to cover in here is going to be the reason people call 911 because something has disrupted their airway system. And so we need to, and we're 911, right? That's who we get called when 911 gets called, right? So we're going to have some fun with this, but you still need to study. Please don't think that you can just watch this video and you're going to be good to go. You need to take notes. You need to stop this. And if you find a word or something I didn't explain clearly enough for you, then you really, really need to Google it, read it, research it. Look, you've got the world at your fingertips. If you're watching this, you have access to an unimaginable amount of information. Just make sure it's accurate and it's coming from a really good source. You've got your textbooks, your instructors, and your fellow students. But please make sure that you don't lose sight of the fact that this is really the first step on the really cool stuff. We've talked about if you don't know it, look it up. If you've never heard it before, go look it up. And again, always go with what is in your book and what your instructors are telling you. One tip for your test is never ever think of what you would do in real life versus what is expected of you to answer from the textbook perspective. You have to get really good at understanding that whether it's the National Registry of EMT exams or quizzes in class, you need to think about what is the appropriate answer from an academic perspective, not so much what you would do in real life. Sometimes that trips people up, and maybe what you would do in real life is the appropriate answer, but it may not be the academic answer. And when you're taking quizzes, you really need to think about the academics. So with that, let's get into it. Okay, so in this module, we're going to talk about some respiratory foundations. This is some background information. Many of you may know this, certainly can skip ahead, but it's stuff that you need to know or you're going to have problems when you get into anatomy, physiology, and pathophysiology. So you have to know this, and I'm going to give you this foundation. I'm going to just kind of review a bunch of stuff you probably already took in some of the earlier EMT training you did. Then we're going to get into the anatomy, the physiology, and the pathophysiology. And then there'll be a part 2 of this video, which will do everything else for you. That's part of the checklist I showed you a little earlier. Okay, so there's one thing you need to understand. The most important step in caring for patients is to make sure that life threats are rapidly identified and addressed, right? So if something is threatening a patient's life, right, from a medical perspective, right, we're not police officers, we're not talking about, in this particular case, somebody outside coming at them with a gun or a knife or something else. Obviously, that's an issue, and you need to deal with that as part of scene safety. But you have a safe scene, and at this point, your most important job is to assure that nothing is threatening this patient's life. And if there is something, you can identify what it is and address it, right? A primary component to ensure that patients that you can do this, right? A primary component of making sure that nothing threatens someone's life is assuring that they can breathe adequately, okay? So when oxygen delivery is disrupted, right? If you can't deliver oxygen to the body tissues and cells, if it's compromised, right? Then you've got a problem. Cells require a constant supply of oxygen. This seems, kind of basic, but it's critical to know because everything we talk about in physiology is going to come into play with this. If you impair cellular function, even for a few seconds, and this is one of the things we're going to find out in here, right? You start to cause oxygen. If you have oxygen deprivation for even a few seconds, that cell is going to suffer. And eventually, if you allow that to continue, there's going to be brain tissue damage, right? They're going to suffer. And the brain tissue will begin to die within 4 to 6 minutes, maybe a little longer, depending on the patient conditions. But the important part to think here is okay. If your job is ultimately to protect that patient from things that threaten their life as best as you can and rapidly identify and address them, one of the most important components here, because of the underlying cellular structures and their need for oxygen, is that you have to maintain the airway, support breathing, and support adequate circulation. It's critical, right? So this is why when you hear the ABCs, a lot of us just repeat it, and we don't really understand the gravity, the depth, the reality of knowing what does ABC mean. It's not just, it's everything underneath the covers. That's really the cool stuff, and we're going to get into. And really, you're going to walk away with this, hopefully, I hope I'm doing my job right, you're going to walk away with this really getting this stuff and understanding it really, really well. Okay, I'm going to skip that, and we're going to skip through this. We'll come back to that at another time. But what I want to do is jump into respiratory foundations. And so, again, this section, just going to give you some background. You probably know all this, but I want to take it from square one, and we're going to build on this as we get into anatomy. And I know if you can get this, everything else will start to fall into place. If you don't get this, then you're just going to be memorizing. And one of the worst things you can do in the EMT program is just memorize, right? There is a time and place you'll have to memorize some things, but for the most part, you need to know the why. And if you know how the why of something, if you know how something works in the body, you'll have a much, much higher pass rate. And ultimately, when you get on the road, you're going to be so much more confident because you're going to really understand deep down. You're going to be the difference between an EMT that's just kind of going through the motions, throwing somebody on a stretcher and rushing them to the hospital, right? And the EMT that can sit there and confidently have a conversation with paramedics or physicians or other clinicians, and they're going to respect you. So let's start with the foundations. Okay, I want to start with talking about the components of human anatomy. And again, this is going to be important for you because we're going to build on all this. Just trust me, hang in there, and you'll be good. At the very lowest level, we have chemicals, right? When we're talking about a human, an overall human, there are chemicals at play here. And within those chemicals, there are atoms. Now, in this program, we don't get too deep into this. We're going to talk about some chemicals, right? Some chemical processes like carbon dioxide. We're going to talk about oxygen. We're going to talk about atmosphere and some other things. We're not going to go really deep into chemicals. Now, you're going to talk a little bit in some other programs about pharmacology, right, and the administration of medications, and that will play a part in understanding that at the very core of all human anatomy is a set of chemical processes that are governed by atoms. That's all you need to know. In your head, I just want you to know the baseline is, hey, there are chemical processes going on in the body, and we're going to learn some of those chemical processes. I promise it'll be painless. Now, those chemical processes in our bodies always interact at a cellular level. You need to know that. Just know chemicals interact at a cellular level, okay? And for the purposes of this, also think about the fact that food is a chemical. What you drink is a set of chemicals, right? So it's not just what you breathe and what's happening in your blood. It's all of these things together, and all of that ultimately either has to be broken down in such a way that it can work at the most basic chemical level, and all of that will interact with the cellular structure. There'll be cellular interaction. Right, so we call that the cells, right? And so here's where it kind of gets, we start to speed up and really start to bring the human body together, right? The chemical processes and the cellular level are the most smallest, lowest form of the human components. So from there we have tissue, which all tissue is a kind of set of cells that work together, right? A group of cells that work together. And tissues form organs, right? Like the heart, the liver, and the brain. And you have other organs in your body, and I'm sure you can name a whole bunch of them. And then lastly, when we bring similar organs that support a specific type of work in the body or in the human anatomy, right? We call that an organ system. And we have like the cardiovascular system, we have the respiratory system, the nervous system, right? And so ultimately when you take all of that and bring it all together, we have an organism, and in this case, it's a human organism. But what's really important for you to understand, you have to understand this, and if you can keep this in your head, this will help you tremendously, right? And also help reduce any anxiety you might be feeling about, okay, how does all this stuff work together? Well, what's important is if we go from chemical to organism or organism to chemical, those processes are what's going to help a human stay healthy or not. Okay, so if I bring something into the human through their mouth, their ears, their nose, or through a trauma event, it's going to impact organ systems. As organ systems are impacted, we need to know what organs are impacted. We need to know what's happening at a tissue level, cellular level, and chemical level. Right? If we start at the chemical level and chemical processes aren't working right in the body, right? We're not talking about giving somebody a chemical, but in the body, as chemicals aren't working correctly with the cellular structure, and that's going to impact our tissues, that's going to impact the organ systems, and the organism. So I just want you to understand that kind of there's a chain of events, a set of layers here. And as you understand that, it's going to be a great foundation for some of the other things that we're going to talk about as we progress through this program. So I want to give you some basic concepts, right? We understand the components of anatomy now, right? I hope you do, or at least have an idea, and you can go back, obviously, and kind of get that in your head. And what I want you to know is a term known as homeostasis. Now, you may know what that means, but if you don't, it simply means that everything in the body is in balance, okay? And the way to remember this, or I remember it, is the body's in a Zen state. Your mind might not be, because you got crazy thoughts going on, or stress or anxiety to pass a test or whatever it is, but your body's ultimately in a state of homeostasis in most cases, right? You may have some higher blood pressure, lower blood pressure, but what happens is the body's always trying to regulate or do what's known as homeostatic regulation, which is get the body back into balance, okay? It's kind of like an ebb and flow, right? You're like driving a car down the road is the same thing your body's doing. As you drive a car down the road, you're always making tiny little adjustments to the steering wheel to keep it perfectly straight on the road. Unless obviously you're going around a curve or making a turn, but if you're going down a straight road, you're going to keep adjusting the steering wheel and probably doing it not even thinking about it. And that's what homeostatic regulation is. Your body's making tiny little adjustments. Where's it making those adjustments? At a cellular level. Right? How is it doing those? Through chemical processes. What does that impact? Tissues, organs, and organ systems, and ultimately you as the human. See how that all works? And now you're becoming a master. Okay, within the body, there's also something known as receptors, effectors, and control system. So how does the body know that the body's not in a homeostasis state? How does it know it's out of balance? We have these things called receptors. Don't worry about what they look like or whatever. All the receptor you need to know is all receptors in the human body receive some type of stimulus that tells them something has changed. And their job is to notify what's known as the control center. And the control center then says, oh, for that stimulus or that information that you're getting from that receptor, I need to dispatch it to something known as an effector. And then the effector will make a decision as to, hey, I need to do this. I need to make an adjustment. Okay, so how does that all occur? As a chemical process within the body, right? Where does it occur? At a cellular level. What's it impact? Tissues, organs, organ systems, and ultimately the body. Okay, so what is negative feedback if you hear that term? It means that something in the body is affecting homeostasis. The body's not in balance. Okay, so hopefully all this makes sense to you. Again, this is general concepts. We're going to get to the specifics around airway management in just a little bit. I just want to make sure that as we get into that stuff, you have the basics down. All right, so I'm going to make this a little silly. A way to think about receptors, control centers, and effectors, I use minions. But I just want to, in this image, you can see that, hey, this minion receptor has a problem. A lot of boxes are falling all over the place. They're just going to send a signal up to the control center. The control center is like, hey, what are you talking about? And eventually that control center is going to notify the effector, and the cool minion on the right-hand side here is going to take action to figure out how to deal with these boxes being thrown all over the place. Silly as it sounds, this kind of simplifies what's happening in your body. And if you can get this kind of understanding, when we start talking about chemical receptors or alpha receptors or other things like that later on, you'll have an image and a little bit of, hopefully, a fun way to think about that stuff, okay? So that's why we're taking that trip down receptor land. Okay, we got Mickey Mouse. Mickey Mouse is in what's doing what? He's very Zen-like right now, right? So that means his body and his mind, or we can describe it as being homeostasis, in a state of homeostasis, right? He is balanced, he is calm, he's relaxed, everything's working well. His circulatory, respiratory system, all of that is doing really, really well. He's all in balance. But what if Mickey starts to look like this? And he's sweating, right? We can tell he's sweating. He seems like he's having a little bit of trouble breathing here. So what's happened? How come he's sweating? Well, ultimately, it's because there was some form of chemical process that has taken place, right, between the receptors and the effectors. The receptors have been told, hey, there's something happening in Mickey's body. Maybe the temperature's raised, and we're in a hot room and our body temperature's gone up. The receptors are analyzing and understanding that. They're letting the command center know. The command center, or control center rather, is going to be telling the effectors, and the effectors are going to say, hey, we need to start sweating to shed some of this temperature. Right? So this is a real simple example, but I don't care what you talk about in the body, there's going to be some form of analysis done, some form of monitoring, and eventually you're going to have receptors send signals back to the control center, which is eventually going to fire off messages to the effectors, and the effectors are going to affect change. And that change is going to always be get the body back into a state of homeostasis, right? To get Mickey back into a calm state. So our goal ultimately, what we're always trying to do as an EMT, what we're trying to do is to return the body back to a homeostasis state. Right? That's all we're doing. That's all pretty much all medicine is how do we get the human being back to a state of balance, right? So every medical condition, every risk factor, symptom, and treatment is ultimately focused on getting us back to Zen, or what we would actually call homeostasis. You should probably not tell your instructor, dudette, I'm just trying to get this patient back to Zen. But in your mind, hopefully that gives you a little bit of a way to think about what we're doing. The foundation of homeostasis, ultimately to get anybody back to a balanced state, we have to have a patent airway, right? If we don't have a patent airway, and a patent airway means an airway basically that works, that's intact and does its job, then and the patient is breathing and performing circulation at an adequate level, then we can get homeostasis. If you don't have those things, right? If we don't have a patent airway, if the patient can't breathe and there's no adequate circulation, Mickey will not be in a Zenful state. So our goal is ultimately to achieve homeostasis, and the first step in doing that is assuring we have a patent airway, the patient's breathing, and we have adequate circulation. We have to have those three things. And how we have those things and how those things are adjusted is the remainder of this program. Okay, we're going to forget our little friend and just keep moving along. One thing I want to make sure you understand, because this is fundamental to airway management, again, we're just going through the basics here, is you should have a really good understanding by this part of the program in how blood flows, right? The blood flow algorithm, if you will, right? How does blood flow from the body through the heart to the lungs and then back to the heart and then through the rest of the body? If you don't know that, we're going to cover it a little bit, but you need to at least know the different parts of the heart here. So you should pause this and at least get familiar with these parts. And, again, we're going to cover some of this. I'm going to point out a couple things here before we go on. This is the pulmonary artery, right? So this is taking unoxygenated blood to the lungs. It is the only artery in the body that uses or carries unoxygenated blood. See how it splits here? A lot of us don't realize that this split occurs, and that means one part of the pulmonary artery goes to the left lungs and one part goes to the right lungs. Okay, we're going to talk a lot about that. And if you see here, there's the pulmonary veins. You can see the holes here that come into the left atrium. So once oxygen is picked up in the lungs by the blood, it returns back through the pulmonary veins. And again, this is important to understand that these are the only veins which carry oxygenated blood. So a trick question is, what do veins carry? Your appropriate answer should be, what veins are we talking about, right? What type of blood are carried in arteries? Well, this is the type of blood except in the pulmonary artery. But again, there's two veins that are coming back into this left atrium, right? One from the left lung and one from the right lung. So you need to understand that, right? Because if you have injuries or trauma or some type of disease state, it's almost like the body was designed to have backup systems, okay? So just keep that in mind. Please understand this anatomy. We're going to go into the circulatory blood flow thing in just a bit. So actually, we're going to go into it right now. Okay, so let's start off here. This here, the blue, is obviously unoxygenated blood. I just want to go through this real quick. We have the inferior vena cava and the superior vena cava, right? And they're bringing unoxygenated blood from the upper and lower extremities, respectively. And they're going to dump it into, this here is the heart. They're going to pump it into the right atrium. there's a little valve here, which you should know what that is, and if you don't, go look it up. And that's going to go into this right ventricle. From the right ventricle, we're going to go into the pulmonary artery, which carries what type of blood? You should know the answer. And it's going to split and go into the left lung and right lung. Notice that the right lung has 3 lobes, right? There's 3 lobes in this lung. And in the left lung, there are 2 lobes, okay? And then the blood coming from this pulmonary artery gets broken out, in both cases, to capillaries, the capillaries of the left and right lung. And then they turn from blue to red, and they go into the pulmonary vein, respectively, right? So we have arteries, we have arterioles in the lungs, right and left, that go back through the pulmonary vein and get dumped into the left atrium. And from the left atrium goes down into the left ventricle. Now, what kind of blood is coming back from the lungs, even though this is a vein? You should know that. And then it's going to get pumped out to the rest of the body through the aorta. Okay, now that flow is very important for you to understand. So if you don't understand it, you should spend some time learning that. It's critical. Now, the thing that you need to understand, and what we're going to dive into in this program, is how does this stuff go from blue to red? We're going to answer that in just a few slides, okay? So, okay, just a few more basic concepts, right? First, diffusion. You're going to hear about this over and over, and what you need to know is diffusion is always talking about molecules or fluids, but typically molecules from a higher concentration of pressure to a lower concentration of pressure. Now, don't get too wrapped up in what all that means. Just know that diffusion means things move from higher concentration to lower concentration, okay? You can read up on that a little more if you want, but the important part is concentration and pressure from high to low. Osmosis is the diffusion of water across a membrane. Okay, so it's diffusion across a membrane. Okay, so you're moving across a membrane. We'll talk more about this. It'll get easier for you in just a moment. A solution is typically, when we're talking about anatomy or physiology, a mix of a fluid, and we're trying to figure out the amount of water and carbon dioxide or oxygen inside of that solution, okay? So think about how you shake up a protein shake and what are the parts of protein versus fluid or liquid that you put in there, okay? Similar. We're going to talk about 2 different types of metabolism, anaerobic and aerobic. Anaerobic metabolism, no oxygen, without oxygen. Aerobic, with oxygen, okay? Very important. We're going to talk about it. I'm going to give you the whys. Do you need to know this in a little bit? But for right now, anaerobic, no oxygen is involved in the metabolic process. Aerobic, oxygen is involved in the metabolic process. This one next, perfusion. It's a big one, trips a lot of people up. It's basically the circulation of oxygenated blood within an organ or tissue in the adequate amounts for that specific organ or tissue. Or what more specifically, the cells that make up that tissue, which then make up the organ. This is why I explained that to you guys earlier in this deck. So it's very important. It's ultimately perfusion is about adequate oxygenation of a cell. And that word adequate or appropriate are really important to keep in mind. We're always going to keep coming back to adequate and appropriate, okay? But this is basically adequate or appropriate oxygenation of a cell. Okay, keep that in mind. And you should know, okay, if it's a cell, we have a chemical process involved. Cells make up what? And then those things make up what? And eventually we get systems and we get a human, okay? All right. Next part, the respiratory process. This is the process of you, I don't want to use a double entendre here, but the respiratory process basically has 3 components. Ventilation, pulmonary ventilation, which is basically moving air in and out of the lungs. Oxygenation, which is the level of oxygen that we're dealing with. And that could change. We'll talk more about that. And then respiration, which is what we just talked about, right? With perfusion, and it occurs because of diffusion. Okay, so respiration is the cellular exchange. It's the actual process of moving oxygen and carbon dioxide back and forth at a cellular level. We're going to talk about that. I just want you to get familiar with them. I want you to remember VOR, ventilation, oxygenation, respiration, and just have a simple definition for each. Ventilation, moving air in and out of the lungs. Oxygenation, level of oxygen. The level is important. The word level. How much oxygen do we have? How much oxygen do we need? And then respiration is that low-level stuff where we're actually composing a chemical process and we're doing that exchange, that trade of oxygen and carbon dioxide. All right, so here's a little pop quiz for you. I am not going to give you the answers. You can read through this and go through it on your own. The only thing I'll give you is we didn't cover the 4 things we need to figure out. You can skip it. But everything else in here was covered in this section we just went through. And that's all the basics, the kind of foundation. And just so you know, everything we just went through is going to be stuff you need for all the other stuff you take in the EMT program. So it's a really good foundation for starting to think in terms of chemical processes, if it's impacting a cell, is it impacting an organ system, and ultimately how does this impact a human, okay? Or the other way, how does a human, if a human is impacted, ultimately we know that that impact is going to translate down to individual cells and chemical processes. So with that, let's get into the anatomy stuff, right? And again, I've changed this a little bit than the flow you may have in your textbook. So please just understand this is the best way I learn, and I'm hoping it's a good way for you to learn as well. I like starting with the basics and then kind of evolving from there, kind of a crawl, walk, run. All right, with that, anatomy of the respiratory system. I'm going to try to make this as simple as I can for you. So the respiratory system consists of all the structures that make up the upper and lower airway, which support ventilation, oxygenation, and respiration, right? So basically we're saying that, the respiratory system are all the different tools, mechanics, structures, whatever you want to call it, organs, organ systems, right? Tissues, cells, and chemical processes that support ventilation, oxygenation, and respiration. And we break up the anatomy, right, for the respiratory system into the upper airway and lower airway. Upper airway has 5 different structures, and the lower airway has 3. And so the upper airway is composed of the nose, the mouth, the oral cavity, the pharynx, and the larynx. The nose, mouth, and oral cavity are probably pretty familiar to you. You may not be so familiar with the pharynx and larynx. The lower airway is 3 things: trachea, bronchia, and lungs, bronchi. So take a moment and just try to absorb this, right? You can write it down, you can come up with an acronym, but it's not that much information, right? You have upper and lower. So just take a moment to think about it and kind of get it into your head, all right? With that, let's move on and talk about job assignments, right? So what is the job of the upper airway? Its main function is to warm, filter, and humidify the air that's entering the body. Okay? Warm, filter, and humidify the air that enters the body is the job of the upper airway. The lower airway's job is to get that air that's been brought in, right? Ultimately, that's oxygen, to the alveoli, or alveoli. I'm not good on pronouncing these. You'll have to help me with that. But bottom line, we're trying to get oxygen to the smallest unit inside of the human body for the lungs, for the upper airway, okay? So this is important. You're probably going to see it on a quiz. All right, I want to simplify this stuff for you. So I'm not going to go through everything, but basically we have the upper airway and lower airway. We've got the nose, the mouth, the epiglottis, the nasal cavity, the pharynx, and larynx, okay? We have some pleural membranes that are part of the lower. We've got the lungs, right and left lung. We've got intercostal muscles that we'll talk about, which are basically the muscles between the actual skeleton, the ribs. And then we have the diaphragm, which is a really cool, crazy muscle that we'll talk about. But the diaphragm is a muscle. Keep that in mind. Then we have the bronchioles, right, the bronchi, and they break out. And then we have the alveoli, right, which are air sacs. That's all it is. Okay, so that's a kind of general high view. Let's dive in a little bit deeper. So let's start with the upper airway, and there's some things you need to know. Okay, we've kind of just went through this. You need to know what is composed of the upper respiratory tract, right? We said the nose, the mouth, the oral cavity, the pharynx, and larynx, okay? So the anatomy of the nose, mouth, and oral cavity, right? Basically, the mouth, we've got the gingiva, right, which is just basically the gums underneath the teeth, but we call it the gingiva. We've got the tongue. That should be an easy one. Should be a layup. Somebody said, what's the oral cavity? I know I got some gums, which are actually called gingiva. I got my tongue. That's a freebie. And I got the uvula, right? And if you ever think about cartoons and the funny cartoon where the cartoon screams and the camera jumps into the cartoon and you see the uvula, sometimes you'll see like little gremlins punching the uvula. That's all it is. So that's the mouth, right? It is important to understand the tongue because the tongue is going to play a major role in airway obstruction, right? All right, so looking at it from the side, we've got the nasal cavity. We've got the hard and soft palate. We've got the auditory tube, the nasopharynx, the uvula, right, which is this thing here from the front, the oropharynx, the epiglottis, which we'll talk about, the hyoid bone, and the laryngopharynx. All right, we're going to take a deeper dive. So you can stop, you can look at this, and you can look online to get other ideas. But this is basically the components of the nose, mouth, and oral cavity. So let's jump into the pharynx because a lot of questions come up about this. There are 3 components to this, right? There's the nasopharynx, the oropharynx, and the laryngopharynx. Now I'm going to give you a trick on how to remember. Nasal cavity. So this is the first region, right? This is the top. These are in order. Naso, oro, larynx, or laryngo. The naso is the first region, right? This is where it connects in the back of the nasal cavity. So when air comes in, once it passes through that nasal cavity, it's going to transition into the nasopharynx, right? There's basically just going to go from your nasal cavity, your nose, and your sinus areas back into the nasopharynx. The oropharynx, this is where air and food come in from the oral cavity, right? So it's oral, both air and food, unless you eat with your nose, air and food are going to pass through your mouth, right? And go into the oropharynx, right? Now remember, all of this is part of what we call the pharynx. Right, so these are the subsections of the pharynx. It's really important to understand, right? So basically the pharynx goes from your nose and mouth to the esophagus and trachea, right? And that whole region is divided into 3 sections. So it's just really easy to understand. The pharynx is composed of the nasopharynx, the oropharynx, and the laryngopharynx. The laryngopharynx is connected to the oropharynx at the top, right? So from the so basically the nasopharynx is connected to the oro is connected to the laryngopharynx, and then it basically, the laryngopharynx connects to the esophagus and the trachea. Now the esophagus is part of what system? The digestive system. So we're not worried about it in this program, but you need to at least know that that's there, that's where the laryngopharynx connects to. We're more concerned in this program around the trachea. Why? Because the trachea is part of the respiratory system. So if you look at this diagram, you can see the color coding here, and it gives you a good idea of how this stuff works, right? Nasal cavity is bringing in air. The mouth, right? The oral cavity is bringing in air and food, and then those connect to each other, and then ultimately the oro connects to the larynx, and then we have the esophagus and the trachea. And there you go, right? Okay, now let's continue. So that's the anatomy, right? The larynx. The larynx is just basically a cartilaginous structure. It's made of cartilage. That's all that really you need to know. It has and contains the thyroid cartilage. Now, if you were going to become a paramedic, this is really important to know, but even in EMT, you need to know this. The thyroid cartilage is usually pronounced pretty well in a male, and then you have this thin membrane. This next section down is the cricoid cartilage. The cricoid cartilage, what I want you to understand, is the first ring of the trachea, okay? And so what I want you to keep in mind is the division between the upper and lower airways, right? So the larynx, right, ultimately is kind of the end of the road, and the cricoid cartilage is the first place where the trachea begins, okay? And so when we talk about what's part of the lower airway versus the upper airway, you need to know that transition point is the cricoid cartilage, all right? Hopefully that makes sense to you. But if you don't remember what's in the upper and lower airway, you can rewind the video and kind of re-listen to that section. But it's important for you to know what's upper, what's lower. Some people ask, why do I need to know this? Well, what happens if you have trauma to the upper airway? You need to be able to, A, understand what is the upper airway. Now, what happens if you're phoning or calling this into medical control and you need to give a patient report? What happens when you arrive at the hospital, right? You don't want to say, well, their throat, they got hit in the head with a ball, they got hit in the throat with a ball, right? You want to be able to say, look, they were hit, in the upper airway, they were hit in the lower airway. And if you don't know, what that division is and how to spot it anatomically and what makes up what structures, your professionalism drives, is going to go down. So knowing this stuff and knowing how to discuss it in an intelligent and professional and, more importantly, confident manner is critical to your success as an emergency medical technician. Now let's take it to a different level. Let's say you had to go into court and you're going through a deposition where an attorney is grilling you on what you did and how you knew what you were doing and what you observed. And you can't use the proper medical terms. I can guarantee you that attorney is going to make you look extremely foolish and incompetent. So knowing this stuff seems very painful and dry, but there's really important reasons for it, right? You decided to get into the world of medicine. And so the more you can do to be more professional and really take time to learn this, and it's not that hard. I'm trying to make this as simple as you can. There's a lot of gobbledygook on this screen. If you want to stop the video and look at the posterior view and the cross section, you can. But the important part here is, hey, it's a complex structure that's made by cartilaginous it's a complex structure formed by independent cartilaginous structures. It marks where the upper airway ends and the lower airway begins. It includes the thyroid cartilage, which is V-shaped. The cricoid cartilage is the beginning of the trachea. So those are kind of the important things, and that's not that hard to remember, okay? So I'm just trying to give you hopefully some life coaching on why this is important. Now, there's something here to be known about special populations. When we talk about things like the upper airway, it's important to understand that children may have a larger posterior portion of the cranium, so their head's going to flex backwards. When we're talking about airway management, we need to keep that in mind. They may also have smaller mandibles and larger tongues, which can increase the incidence of airway obstruction, right? So you may, number one cause of airway obstruction in infants or children is typically that they have a larger tongue and it gets in the way, and especially if they're unresponsive and unconscious, right? The epiglottis is a little floppier, not as firm, so this can cause some challenges to the airway. Their respiratory anatomy may not be as well developed, so it is more fragile, so we need to think about that when we're handling and treating a child, possibly when we're doing compressions for CPR. We can also think about what the impact of trauma may be on a child. That may be, why it would be more of an impact. So all of this is just important, so we know that we need to provide additional support for a child or infant's neck and head. We want to reduce manual ventilation if we're using a valve mask, when we talk about that later, because we don't want to damage the lower airways infrastructure by overventilating the child. So there's a bunch of things here for you to remember when it comes to children and infants, and the reason I'm having this here is it usually ends up being a test question. But honestly, once you're in the field, you're going to want to know, hey, this is a special case. Let me be really careful about how I interact with this child and this infant in both diagnosing them or evaluating them, I should say, and potentially treating them. All right, so that's all the upper airway. Let's talk about lower airway. On the lower airway, we've got the pleural membranes, which we'll talk about. We've got the lungs. We've got the intercostal muscles, diaphragm, bronchi, and alveoli. We're going to go into these ad nauseum. So the lower airway's function is ultimately what? Deliver oxygen. Get oxygen to the alveoli, okay? And that's done through the trachea, the bronchi, and ultimately the lung cavities. So one thing I want you to keep in mind here that comes up often is the pleura. So if you look over here, the pleura is this stuff here, right? And it's basically a set of thin membranes, and there are two of them. Now, between the pleura, there's this small amount of fluid, and acts like a lubricant to help you breathe, to help with the expansion and contraction of the breathing process. Now, there are two pleura. The visceral pleura covers the outer surface of the lungs, right? And then the peroneal pleura which lines the inside of the thoracic cavity. So parietal is on the thoracic cavity. Visceral covers the surface of the lungs. You just need to get that in your head and understand it. It's going to come up probably as an anatomical question. So just understand. Visceral covers the surface. Parietal covers the thoracic cavity. And their purpose is to support the breathing function. And ultimately, and there's a fluid between the two to help ease, to provide lubrication to help ease breathing. Okay? All right. Let's talk about the trachea, because there's a few things here you need to do it. So the trachea is kind of the first step in getting air, oxygen, into the lungs. And then it's divided into two sections, okay? Well, the trachea doesn't divide, but the trachea then divides into two sections, which are the bronchi. But there's a piece that you need to know, this carina. So this carina here is the piece that it basically, if you think about it, it's kind of like a valve on a plumbing system, right? It allows the air to go off into two directions. And those two directions are the right main bronchus and the left main bronchus. So you just need to know that the trachea leads to the carina. The carina breaks off into two sections, right and left bronchus, right? Basically, the bronchi are left and right bronchus. They distribute oxygen to the lungs. And once the bronchus is inside of the lungs, it's called a bronchiole. They're made of smooth muscle. And then smaller bronchioles eventually connect to the alveoli. So again, it's kind of like a plumbing system in your home. You've got a big pipe that's bringing oxygen in, which goes to a smaller pipe connected by the carina, right? And then the bronchus, or the bronchioles, break down into smaller bronchioles, and those get into eventually the small alveoli. Okay, so hopefully that progression makes sense to you, right? And where does the trachea transition from the upper airway? That's just a bonus question. You should know that. What's the cartilage that creates that transition? What is the larynx? What part of the upper airway or lower airway is the larynx? Is it upper or is it lower? Just throwing some questions out. You should probably know by now. Okay, so we've talked about upper and lower airway. The other thing I want to talk about is the mediastinum. The mediastinum is basically all of the other stuff, right? And I'm not being too technical here. I just want you to think about, well, if we have a right lung and a left lung, what is in between them, right? What is that area called, and what's in it, right? I think I've always wondered that, right? When I got into this line of work, quote unquote, I kind of always thought about, like, well, where's the heart actually? And I learned early on, like, we don't really do a good job sometimes of picturing where the heart is in relation to the lungs and the upper and lower airways, right? So let's dive into that. So this is where the graphic on the screen is kind of a good representation of where what we call the mediastinum. And the mediastinum is basically it's the thoracic cavity, right? And so what it does, what the mediastinum is, it describes the area between, or what we would say medial to the lungs, okay? And within it is going to be the heart, the great vessels, which you should now know are the aorta, superior and inferior vena cava, the esophagus, right, which is not part of the respiratory system, but it is considered part of the mediastinum, the trachea, which is part of which part of the airway system, upper or lower, right, the bronchi, which are what part of the upper or lower respiratory system? You should know this by now, right? But the point is, the mediastinum is really kind of that middle area where the heart, the great vessels, the esophagus, trachea. But don't get tripped up. Be careful that you don't get a tricky question where you get asked, is the esophagus part of the respiratory system? No, it is not. But it is contained within the mediastinum, and all of these structures live within the thoracic cavity, okay? And they're surrounded by the ribs and the intercostal muscles, okay? So within this, so one thing I want to talk about is the diaphragm, right? Which is this down here, this muscle down here. So we're going to get into inhalation and exhalation, inspiration and expiration in a moment. But how does this diaphragm get controlled? How does it, actually do the process of helping us breathe and bring air in and out of our system? Well, the way this is done is through the phrenic nerve. So I want, in this graphic, I don't show both, but there is a left and right phrenic nerve. And the phrenic nerve is C3, C4, and C5. It branches off of there. Now, there's other areas that this cervical branching occurs to, but see the cervical, C3, C4, and C5 on the cervical spine, they have direct pathways that are the phrenic nerve. And the phrenic nerve goes all the way down to the diaphragm. So here's a few things to know, and this is where it starts to get a little cool. Why do we put a C-collar on? Why are we so concerned with spinal immobilization? We always say, well, we don't want to create an injury to the spine. We don't want to complicate or increase an injury to the spine. But here's the thing. Now that you start getting all this and you start understanding it, you should start understanding that, okay, we understand where the cervical spine is. We understand now that C3, C4, and C5 have a phrenic nerve. And this phrenic nerve goes down to the diaphragm. And the diaphragm is part of what? The respiratory system, right? It's part of the overall respiratory system. And what does the diaphragm do? The diaphragm helps to do what? Support ventilation. And without ventilation, we can't have oxygenation. And without oxygenation, we can't have respiration. And if we don't have respiration, we don't have chemical processes at a cellular level, which means the cell dies. And if the cell dies, what happens over time? The patient dies. So we put on cervical collars and we mobilize the neck when we suspect potential trauma injury, or we have to be careful of trauma or injury occurring, because we don't want the phrenic nerve, or any of the nerves, but especially the phrenic nerve, becoming damaged. Because what happens if I cut this nerve, ding it, or in some way inhibit its performance? The diaphragm may not function properly, right? And then maybe it will, and we won't have full ventilation. But the important part here is I want you to start having those aha moments like, okay, now I'm starting to see where all this stuff comes together. And how does this happen? It's through a message, right? Through an electrical stimulus, right? And so part of what's going to be controlled here and telling the diaphragm to either contract or relax is going to be those effectors and receptors in the command center and all the things we talked about earlier, right? So now hopefully this is starting to come together for you, right? Because when this diaphragm gets message to go, hey, contract, that's going to start causing what? Us to ventilate, right? It's going to cause us to breathe. And that breathing is going to set off a whole bunch of stuff. So it's so very simple, yet such an amazingly cool, complicated set of processes that come together that help us maintain life. And then obviously one of our key goals is to make sure that we address anything that could be life-threatening. So again, that's why we collar somebody up, okay? All right, pop quiz. So I'm going to let you guys pause the video when you want, and you can go ahead and put this together on your own and answer what's here. Okay, so now we've kind of got a good or basic understanding of the respiratory anatomy. I hope it's made a lot of sense. You probably need to go read the books and look at some other charts and get some, but it should give you a good foundation of the upper and lower, the mediastinum, how the phrenic nerves work, kind of some of the little bit of the role of the diaphragm. You've got a quick exposure to ventilation, oxygenation, and respiration. We started talking a little bit about the different parts of the pharynx and how that's broken out, where the transition point is from upper to lower. So you've gotten a really good amount of information. Right now, you should be feeling pretty good. If you're starting to get this, even at any tiny level, maybe you got to listen to this 2 or 3 more times. Maybe now when you read the book, it'll be a little bit clearer for you. Here's the point. You're getting it. You're starting to make it all come together, right? And you'll be able to discuss it and eventually teach it. Okay, so respiratory physiology. Now that we got the anatomy, we got to go figure out, like, how does all that chemical junk and crap work, right? So let's go figure that out. The first thing you got to keep in mind is the respiratory and cardiovascular systems have to work together. If either one of those break down, then we can't ensure a consistent supply of oxygen and nutrients to the cells. And we already know that if we can't get the cells to, if the cells don't get what they want, it all breaks down, right? Whether it's one cell, because one cell breaks down, another one, and another one, another one. Why? Because they all kind of work together to form tissue, and tissues form organs, and organs form organ systems, and that all forms humans. So when we have a breakdown anywhere along that line, we've got a problem. The other thing to know is ultimately what we're talking about here is the removal of carbon dioxide, which is waste. So really what we're trying to do is get the cells their oxygen and nutrients and get carbon dioxide out of there, right? So it's just basically like a delivery. Think about it. It's like, FedEx, UPS, Amazon Prime, they deliver the oxygen, and then we got a sanitation crew that takes out the carbon dioxide. Okay, that's really ultimately what we're trying to do when we talk about the physiology of breathing, is we're trying to figure out how does that happen, right? But most importantly, the respiratory and cardiovascular systems have to work together. If they don't, if either one of those systems, the heart stops pumping, we have a breakdown, right? We can't get oxygen. So what do we have to do? CPR, resuscitation. Why? Because we're trying to get the pump back online so that we can get oxygen in the system, so that we can flow blood and eventually get oxygen to the cells, right? All right. And more importantly, and not more importantly, but just as importantly, get carbon dioxide out. So let's talk a little bit about how breathing and circulation work at a high level. This is at a high level. You guys should have a much deeper level when we talked about how blood flow works, right? You should know the inferior, superior vena cava dump blood to what. At this point, you should just know this stuff, and that's a great sign. You're learning. But air enters the body through the oral and nasal cavities, which is part of what? The what? Upper airway, right? Travels through the lungs via what structures? Okay, so air enters the body through the oral and nasal cavities. I'm not going to answer this. I want you to think about, okay, what is the lower air, the lower airway, and what's it comprised of, right? So we need to know those things that the lower, I told you there's 3 things that comprise the lower airway. All right, and this occurs, why does air actually even enter our body? Well, it occurs because of something called negative pressure. Negative is, in this case, when we talk about negative pressure, we mean less pressure on the inside of the body than the outside. So it kind of creates this funky scientific vacuumy thing that when you have negative pressure, pressure always tries to equalize, right? Atmosphere tries to equalize. The atmosphere outside the body versus inside the body, there's a differential in pressure. We try to equalize that pressure, and so air is sucked in. That's basically what's happening. Okay, so this isn't negative like somebody called you a name, right? So what happens when we create this negative pressure is the thoracic cavity enlarges, the diaphragm and the intercostal muscles, which are the muscles between the ribs, contract. The diaphragm contracts, makes it smaller, allows the lungs to take in air. So if you breathe in right now through your nose or your mouth, while I'm talking to you, you're creating negative pressure, your thoracic cavity enlarges, diaphragm contracts, intercostal muscles in the ribs contract. Okay, the intercostal muscles along the thoracic cavity in between the ribs contract as well. So when you do this, what's going to happen is air is going to reach the alveolar and it binds to hemoglobin. Now what we really are saying is oxygen. Oxygen binds to hemoglobin in the blood, which arrives from, now where's the blood come from? To the lungs. How does the blood, what is the one structure that brings the blood from the heart to the lungs? It's the only structure that's opposite of every other structure like it in the body. You need to know that. I'm not going to give you the answer. At the same time, at the exact same time that this blood's arriving and we're binding oxygen to hemoglobin, we've got to get rid of carbon dioxide. It diffuses, which means it moves, diffusion's occurring. So it's going from a high pressure to a low pressure. Right? We talked about that earlier, right? And so it goes from the bloodstream back to the alveoli. And then, right, we have now we have we've taken the oxygen we breathed in and it's been moved to the blood. But, as that's happening simultaneously, the carbon dioxide is moving back into these sacs in the lung and it travels back up what? How does it get back out of the body? Pretty simple. Think about the upper and lower airway and you'll be able to describe exactly how air enters, what the transition is, why it happens, negative pressure, what muscles, what components are involved, the thoracic cavity, the diaphragm, the intercostals, and you'll know where the blood arrives. You'll know how the transition takes place at a high level, right? Now, once we have that oxygenated blood, it moves to the heart via what? How does it get back to the heart? Just what's the name? 2 words, right? How does it get back? And then eventually it's distributed to the body through what? Once it goes through the heart, where's the heart send it? To what part of the body? What hose, right? And then eventually it goes through the body and it returns back to the heart through 2 things. One for the upper extremities, one for the lower. All right, so you need to know all this. You should be able to fill all this in. But once you do this, you know the process of breathing and circulation. And we've talked about it. I did it in the basics. Okay, so we've gone through all this. You can stop and refresh your memory if you wish. But one thing we haven't really figured out is, how does this blue turn the red? Right? How does the blue turn the red? At a high level, we know that, okay, somehow or another, we're taking in oxygen and somehow we're getting rid of carbon dioxide. But how? Okay. So we already touched on this, but I want to get a little bit deeper into this. Ventilation, oxygenation, and respiration. So ventilation is the physical act. We had a little baby definition a little while ago, but physical act of moving oxygen in and out of the lungs. That's ventilation. Oxygenation, again, we had a little baby definition, which works and you can use it, but let's get a little deeper. So this is the process of loading oxygen molecules onto hemoglobin molecules in the bloodstream. Now, I want you to kind of get this, right? So we have these molecules, right, inside of our blood. They're hemoglobin molecules, and oxygen binds to them. It connects to them, right? Think about like a taxi. So you have this hemoglobin taxi coming across the road, and if you live in the city, you can put your hand up and the taxi will stop for you, right? You can go, hey, hemoglobin. Hemoglobin stops. You happen to be an oxygen molecule. You jump in the back seat and you continue down the road. Or in this case, you continue, if you're in the lungs, you continue in the pulmonary vein back to the heart. All right, you're going to take that cab, that hemoglobin cab, back to the heart if you are in the lungs, right? But that's pretty much where this process occurs, right? It's not going to occur somewhere else. So once we have that hemoglobin, right, respiration is that exchange. It's the exchange of oxygen and carbon dioxide. Now, it occurs in the alveoli, but it also occurs in other tissues in the body, right? So once you get back to the heart and you get shot back out and you get distributed to the body, there's going to be this exchange, this exact same exchange at some other part in the body. So let's just pretend what we just talked about. Your oxygen molecule, you get put into a hemoglobin taxi and you get sent back to the heart, and from the heart you get put into the aorta, and from the aorta you travel to the liver, and for some reason when you get to the liver, that's your destination. So you now, as that oxygen molecule, need to get out of the taxi, or the hemoglobin taxi, and into the liver cells, okay? And then while you're there, there's going to be a carbon dioxide molecule, right? And you can say hi to it like, hey, what's up, Frank? Hey, Steve. And then that carbon dioxide molecule is going to jump into the hemoglobin. It's going to jump back into the bloodstream and go back and eventually go to the inferior vena cava and back to the heart. Okay, but I just want to give you a picture. It's a silly picture. It's not the 100% most accurate, but it's enough for you to kind of start understanding a deeper level of ventilation, oxygenation, respiration. Now, what is the overall goal of ventilation, oxygenation, and respiration? The overall goal is to deliver adequate supply of oxygen to the cells. I want you to keep focused on that word adequate. I brought that up before. I said appropriate, adequate. It's very important, because if it's not adequate, then we can't meet the needs of the cell. And at that point, we have a problem on our hands. So we'll talk more about that in a moment. If for any reason this doesn't work the way it's supposed to, cells will begin to die. So ventilation, oxygenation, and respiration are all critical to sustaining life. And we talked about earlier on, one of our most important goals as an EMS provider is to assure we allow nothing to threaten our patient's life. All right? And so this is why we got to get into this and know it, because you're going to start diagnosing what's wrong with a patient by understanding their ventilation, their oxygenation levels, and their ability to effectively perform respiration. Get it? That's why we're talking about this, because eventually you're going to have to make a clinical decision, and it's going to be based on one of these. All right? You're going to have to figure out which one of these is wrong in your patient, and then adjust and address that situation. All right, so let's get deeper into ventilation. Inside ventilation, and that's not a term, I'm just saying, let's get inside ventilation. Basically, it's the physical act of moving air into and out of the lungs. We already know that. It involves inhalation. Now, there are complex receptors and feedback loops that tell us when to ventilate. right? So something in our body is monitoring what's going on, which we call receptors, and we talked about those earlier. This is why you needed to know it. And, what happens is the receptor goes, hey, we're having an issue here, right? Think about that minion on the factory floor that's saying, I need some help. And what kind of help does it need? Well, basically, the receptor is going to fire off whenever it doesn't have enough oxygen. Because if it doesn't have enough oxygen, we're going to get into something called hypoxia. The human body is going to become hypoxic, or the condition of hypoxia will develop. So it's extremely dangerous when we have hypoxia. Why? Because we don't have the appropriate and adequate amount of oxygen to meet the needs of the cell. And that's important for you to know. It's important for you to know that hypoxia is just basically you have an inappropriate level, right? You have a inefficient level, a low level, right? Hypo, low level of oxygen. But why? Because the cell or tissues that are hypoxic don't have enough to meet their needs. And I keep saying their needs because there's no one standard across the body. So the receptors are going to freak out. They're going to send a message and go, hey, we have a problem here. Now, the way this occurs is because there are changes that the receptor is monitoring for. And those changes are basically pH changes in the body, right? Or the cerebral fluid. The blood and cerebral fluid. Now remember, we've got to get homeostasis, right? We've got to get back to balance. So if we have high carbon dioxide, we got too much carbon dioxide in the body, what do we want to do? Well, we want to get back to a neutral, we want to get to a more balanced level of oxygen. We need to have oxygen because we got to get those cells what they want, right? So when our receptors determine that there's too much carbon dioxide, right, they're going to fire off a message, and that's going to cause a message to be sent down what nerves? The phrenic nerves that are going to signal the diaphragm that we need to create some negative pressure here by contracting the diaphragm and the intercostal muscles, and that's going to cause a ventilation cycle. Now, the other way we can do is look for pH levels in the cerebral spinal fluid, right? So if carbon dioxide begins to rise, the pH level in our cerebral spinal fluid begins to decrease, right? So they're kind of, one goes one way, the other goes another way. And if one doesn't fire off the receptor, the other one will. But ultimately, we want to make sure that we're in balance. So the receptor is going to monitor that or get a message telling it that it's, hey, this stuff's off and we need to do something about it. I want you to also know that ventilation includes rate and depth. How much ventilation are we doing? Right? When we're measuring respiratory rates, we're actually measuring the amount of time somebody ventilates, right? And that's important to understand. When we count how often somebody's quote unquote breathing, what we're really doing is counting how many times they ventilate per minute. Ventilation has a certain depth. How much oxygen you're taking? What is your depth of ventilation? Now, just because you're ventilating, and we'll get into this in a moment, doesn't mean that you're also oxygenating and respirating, right? So you can have really good ventilation and not so good oxygenation and respiration. Remember I said you got to figure out the three of these, and that's going to tell you what's wrong with your patient. So let's say this fails. Let's say the receptor is like, I'm taking a break, right? Because minions do that. And by now I think you should know that the entire body, when I say cells and receptors are really minions. And you probably watched Despicable Me and you understand they can be a little flaky. So what happens when they take a break? The hypoxic drive kicks in. Now the hypoxic drive is this backup system. And it basically, it's a respiratory drive, right? Which basically says, if there's, it relies on the level of oxygen, right? It's got oxygen receptors or chemoreceptors that are really looking at how much oxygen we have in the plasma of the blood, or the plasma in the body, right? So basically it's looking for, is there too much oxygen in the plasma? Because that means we're not having efficient exchanges. And if we have too much oxygen, it's going to send another message saying, hey, we got to balance this out, right? I got a problem here. I got to get the body back to a homeostasis state, right? Now, typically you're going to see this in patients with late stage or end stage COPD. So I want you to understand a hypoxic drive can happen if you don't have somebody with COPD. but typically it's going seen with patients with end-stage COPD. But typically it's going to happen because there is some type of obstruction that is causing, and by obstruction I mean messaging obstruction or some other form of chemical process obstruction, something that is causing those receptors to not recognize that either there's an increase in CO2 or decrease in pH. And so the body's going to kick over to the hypoxic drive, right, which is looking for the amount of oxygen dissolved in plasma. And then if it's too much, it's going to say, hey, we got a problem. Again, it's trying to get everything back in balance. All right, COPD, I'm not going to spend too much time on it. It means chronic obstructive pulmonary disease. It can describe a series of different types of lung diseases, including emphysema and chronic bronchitis. It basically, somebody's going to be breathless, having a hard time ventilating. And it's usually because the body is using a hypoxic drive. So it takes a little longer for them to get that signal through the phrenic nerve down to the diaphragm to cause that ventilation cycle. It's going to be diagnosed by a doctor. So this isn't something that you in the field are going to say that person's got COPD. It's going to be something that becomes a diagnosis based on other testing and imaging. But you may run into a patient who's been diagnosed with COPD. If you look here on the right, you'll see that this is a healthy airway, right? So we have a bronchial tube, it's open, it's clear, you can get air in and out. And this is a healthy alveoli. Down here you'll see these are constricted, right? So here we have chronic bronchitis where the bronchial tube has been constricted. All right, it's inflamed and it has a bunch of mucus in it, so you can hear these rails. And then you have here emphysema, right, which the membrane itself is breaking down. And when the membrane breaks down, we have a problem with exchange of oxygen and carbon dioxide and other challenges. So we're not going to go too much deeper into this, but it does comes up on quizzes, it comes up on tests, so you should probably have a good understanding of what this is and maybe get to know this a little better. So here's what we were talking about before. A patient could be ventilating, but it doesn't mean that they're oxygenating. So you could have somebody who's breathing and ventilating, but the oxygen levels aren't appropriate. What if the patient's in a fire and breathing in smoke? How well is that oxygen level? How well are they going to be oxygenating? What if they're on the top of on a mountain on top of the world? It's supposed to be top of the world, and they're not able to get the level of oxygen that they would at ground level or sea level. What if they have a flail chest or an airway obstruction? Something is blocking the amount of air that can get into the body, and that minimizes what? The amount of oxygen. And remember, ultimately, this is all about what the cells need. So if the cells aren't getting what they need, and they have some pretty serious demands, right, then they just shut down. So we need to think about, what about an injury to the spine that impacts the phrenic nerve, right? So in that situation, maybe we're not able we're still ventilating, the patient's able to breathe somewhat, maybe they're getting a partial instruction, but they can't fully ventilate. So failure to ventilate properly leads to challenges with oxygen and respiration, right? Hopefully that makes sense to you. So you need to understand, like, okay, if this patient's ventilating, but I'm still seeing other issues related to the respiratory system, then they're probably occurring at the oxygenation level or the respiration level. Okay. So let's talk a little bit about some terms and concepts related to ventilation. All right, partial pressure, right? This is the amount of gas that's in the air or dissolved in fluid. All right. Oxygen and carbon dioxide both diffuse until the partial pressures in the air and blood are equal, right? So basically we're going to have movement by oxygen and carbon dioxide from high to low pressures, high to low concentrations, until they're both equal. So we're trying to equal out this movement. When we can't do that, when we violate the partial pressure, when we can't get our carbon and our carbon dioxide and our oxygen to equalize out, we end up with a tension pneumothorax. And you'll learn more about that in other modules. Now, tidal volume, right? This is the amount of air that is moved in and out of the lungs during one breath. So one standard movement of ventilation, one ventilation cycle, standard movement of air is going to be about 500 milliliters on average. And so tidal volume is just the entire movement of air in and out of the lungs, right? The inhalation and expiration. Dead space is the amount of air that does not reach the alveoli. So if you had 500 milliliters and only 450 got there, the 50 would be the dead space. We're going to talk about internal and external respiration, but basically internal respiration is the process of exchanging CO2 and O2 with cells, and external is CO2 and O2 between capillaries and alveoli. We're going to look at this a little more, so I'm not going to go too deep. And residual volume is just that, the residual. What's left after you breathe everything out of your body? There's always going to be something left. So whatever that's left behind, if you were to take a breath out, and there's going to be something left in your lungs, and that's going to be the residual volume. Okay, so some things you just need to kind of learn these terms. You might want to just repeat them in your head 20,000 million times, but these are going to come up over and over on quizzes. And an important part here is if somebody can't get all the air out, if their tidal volume is very low, obviously if the tidal volume is low, that means they don't get a full ventilation. If they're not getting a full ventilation, that means you're not performing oxygenation correctly because you don't have enough to work with. And so hence respiration will be impacted. So you just need to kind of think about how these connect back to ventilation, oxygenation, and respiration. Everything we do in airway management comes back to that. So we talked about inspiration and inhalation. We've mentioned it, right? So this is the active part of breathing, right? This is the breath in, right? We've already said this tons of times. The diaphragm and intercostal muscles contract, right? This creates negative pressure. We've talked about that, which allows air to enter into the respiratory system. And then the only purpose here is to deliver oxygen to the alveoli. All right. Then there's expiration. This normally is not going to require a lot of muscular effort. It's just kind of a relaxation of the muscles. They return to their relaxed state. It's a passive process, right? We don't really have much to do here. And it's, basically some of the air will be compressed. But ultimately what you need to know is during inspiration or inhalation, you'll hear both terms, the diaphragm contracts, and so do the intercostal muscles. And we have negative pressure. During expiration or exhalation, diaphragm, intercostal muscles relax, and the thoracic cavity reduces. Means just your thoracic cavity just gets smaller because it hasn't, it's not expanded, right? It's pretty simple, pretty straightforward. Two terms you need to know: hypoxemia and hypoxia. Now these are going to become important as we get into other areas like oxygenation and respiration. Hypoxemia is a low level of oxygen in the blood, in the arterial blood, right? Which is the blood sent from the heart to the body. It's also known as systemic circulation. So the blood in your femoral artery, the blood in your arteries in your arms and in the lower legs, the carotid arteries, those are arterial blood, right? So they can suffer, if they suddenly suffer from a low level of oxygen, we're not getting enough oxygen, even though maybe we're ventilating, then hypoxemia is going to occur. Hypoxia is low level oxygen at the cellular level. Really important that you understand the two of these are different. Hypoxemia leads to hypoxia. So if you have low amount of oxygen in the blood, in the arterial blood, right, then you can't do the respiration. You can't give the cells what they need, and that's going to lead to the cells getting really pissed off and eventually just dying, right, which is hypoxia. They don't have enough. They're not getting what they want. Okay, both are going to be treated the same way through oxygen therapy. So that brings us to oxygenation. So oxygenation is what we've said, the process of loading oxygen molecules onto the hemoglobin molecules. And we've talked about the hemoglobin cab and you being an oxygen module. But this is a good kind of diagram of it, right? So we have from heart and systemic circulation. So what is that? Well, we're bringing this stuff in through the vena cavas to the heart and then ultimately to the pulmonary artery. We've talked about that. And we have all these little hemoglobin molecules, or actually these are coming in, and then they pass into capillaries, right? And these capillaries surround the alveoli. And what happens is you have the CO2 leave, they get out of the cab, get out of the hemoglobin cab, and the oxygen molecules jump into the cab. And then they go back through the pulmonary vein and back to the heart, and then through the aorta, they go to what's known as systemic circulation. Hopefully you know what systemic circulation is, but if not, systemic circulation is all the circulation that takes place throughout the systems of the body, Okay, easiest way to know it. So as you can see here, as we breathe in, the CO2 is coming in, and then as we build up the carbon dioxide, it gets sent back out. And you should already know what part of this is upper and lower airway. All right, so this is required for internal respiration to take place. Now, external respiration is basically this, right? External respiration occurs in the respiratory system. Internal respiration takes place typically in the systemic system, right? During systemic circulation. Now, just because you have oxygenation occurring, it does not guarantee that internal respiration is taking place, meaning we may not be having respiration occurring. We'll talk more about it in a moment. Ventilation without oxygenation can occur. We've talked about that. You can be ventilating and not getting any oxygen, which then will lead to depleted oxygen levels and then failure of respiration, right? Hopefully all this is now starting to come together and you're seeing how it all fits, one piece fits into another and almost becomes kind of like we're repeating it over and over, which is good, right? Because it means that you're starting to get it. Okay, let's talk about carbon monoxide, not dioxide, but carbon monoxide real quick. Carbon monoxide is really attracted to hemoglobin molecules. So, we're all probably in school, you had a crush on somebody, they didn't really give you the time of day because they were really busy with someone else and they were dating somebody else. But man, if you got a chance to get to know them, you'd be all over them, right? Well, that's what carbon monoxide's like. Carbon monoxide is like sitting there and watching and watching and watching. If it gets into the bloodstream and it gets into your system, it's going to jump all over those hemoglobin molecules. And if that occurs, you're going to have an issue because the blood is going to look like it's oxygenated, right? If you were to do a pulse ox, if you were to measure the amount of oxygen in the blood using a standard pulse ox, it is going to see that, oh wow, there's a lot of molecules riding along the hemoglobin molecule, so we must be good. But in reality, they're carbon monoxide molecules. And this is a problem when somebody's exposed to carbon monoxide. So they could be ventilating. You could think they're oxygenating, but it's actually carbon monoxide because you did a pulse ox. This also comes up in somebody that may have anemia. Well, actually in a different way, but we'll talk about it. All right, so let's talk about respiration. The first thing we're going to talk about is cellular respiration. So all living cells perform a specific function and need energy, right, or fuel, right? And so energy is created through a chemical process, surprise, surprise, right? And basically in that process, what we're doing is we're trying to get nutrients into the cell, right? So chemical processes always take place at a cellular level. We learned that early on. And so this process is known as metabolism. I warned you, you were going to need to know aerobic and anaerobic metabolism. So metabolism is when the cell combines nutrients and oxygen and creates something called ATP. And ATP is basically shorthand for a very long word that you can go look up, but it is basically what produces energy. So glucose is one of the primary sources of energy, and it's done with oxygen, and that's called aerobic metabolism. Now, if there's not enough sufficient oxygen, we have insufficient oxygen, which means we have had a problem with oxygenation and ultimately with respiration, the body will switch over to anaerobic metabolism, right? And so whether you're doing aerobic or anaerobic, you're always going to produce some kind of waste, right? So you get the nutrients in, those nutrients become energy, and ultimately you produce waste. The important part to think about here is that oxygen is being involved. And if you don't have enough oxygen, you go from aerobic to anaerobic, okay? This is a constant process. It's always happening in your body. The metabolism is occurring at all times throughout your entire body, always, not just after you eat a meal. And so if this process is interrupted, the cell's going to die, okay? So you need to understand that ultimately what we're doing is disrupting a metabolic process at the cellular level because we can't get an efficient and adequate exchange or appropriate exchange of carbon dioxide and oxygen. All right. Hopefully all that makes sense. All of this should be starting to come together because we've kind of built blocks, and taken little steps as we go. So let's look at this at a really deep level. We said, how does the blue become red, right? We talked about that earlier. So the actual exchange of oxygen and carbon dioxide in the alveoli and the tissues of the body is what we're talking about when we say respiration, right? So we've already mentioned cells take energy from nutrients through metabolism. The process is accomplished through diffusion. So that actual metabolic process is occurring because of diffusion. Now, I'm not going to tell you what diffusion is because I defined it 2 or 3 times in this presentation. So you need to either go back and figure it out, but you need to understand it, right? Because we have this movement from one type of pressure to another, which is what creates this exchange. Now, there are 2 types of respiration, really important for you to know. There is external respiration. Now, external respiration doesn't mean outside the body. What it really means is that that oxygen and that carbon dioxide, if you look here on the right-hand side of the screen, that's a alveolus, and it's surrounded, you can see here on the left-hand side of the screen, or the middle of the screen, that these are capillaries, right? So the unoxygenated blood comes in, and they're surrounding these alveoli. So they don't actually go inside. What happens here is this diffusion takes place. So air gets inside here, oxygen gets in here, that's the oxygenation process, and then it diffuses, right? It's kind of like it walks through the wall, right? It's, if you had superpowers and you can walk through walls, that's what this is like. If you were an oxygen molecule, you would just walk through this wall, this tissue, this membrane, and then you'd get inside of this capillary, right? And then you'd go back in to the artery and go back to the heart. Now, as you're getting in, these carbon dioxide molecules are walking through the same wall the other way. The reason is because they're trying to equalize pressure. We're trying to get carbon dioxide moving from a high pressure to low pressure. I'm giving you the answer. And then the same thing for the oxygen. So that's how it moves through. But external respiration is what is occurring in the lungs. Okay, it's happening in the pulmonary capillaries, right? It's this exchange of oxygen and carbon dioxide in the pulmonary system. All right, it's very important you know that. It's not outside the body. Okay, internal respiration. We've already kind of talked about that. Internal respiration is when this goes back to the heart. When you have the oxygenated blood go back to the heart, gets back there through the pulmonary vein and drops off into the left atrium, goes through a valve. You should know what it is, mitral. Goes down to the left ventricle and then to the aorta. And then somewhere it's going to get shot out into the body and go into one of the organs or other parts of the body, the brain or something. And then there's going to be what's called a exchange of oxygen and carbon dioxide between the systemic circulatory system and cells, right? That's how it goes back. And this diffusion process will occur at a cell level within an organ, right? Within the tissues of the organ. And all of that is perfusion, which we mentioned really, really early on. I'm hoping you kind of understand this now. I'm trying to do my very best to break down this seemingly complicated thing to something that hopefully makes sense with you. So I'm throwing in some stupid, silly stuff like minions and taxi cabs and high school dating to give you some anchor points that maybe you can use to keep this in your head. So we just talked all about this, so I'm not going to go through this again. But I will show you this, right? So this is a really good representation. So the external respiration up at the top here, this is all occurring at the inside the pulmonary system, right, within the lungs and the alveoli, and it's just an exchange of CO2 and O2. And then once it gets back into the into the body, it's going to be internal respiration, right? And these cells, right, we get the ATP, the energy exchange. We're not going to get into mitochondria, but this is where the metabolic processes are occurring. And we use nutrients, we create energy, and then that also creates waste, and there's an exchange. And all of that occurs. And the way that this moves back and forth between these two systems, because these are walls, right? They're not inside of each other, is diffusion. Okay. So here are a whole bunch of questions. You guys can stop the video. This is not, please don't think this is some magical insider secret. I don't know if these things are going to appear in your exams or not. You should probably take time to really think about other questions that could come up and maybe create flashcards or use flashcards. So let's talk about pathophysiology. So pathophysiology is basically just a convergence of pathology and physiology. And pathology is just a medical discipline that tries to describe a condition, right? That's all it is. So we're trying to describe a condition. And pathophysiology is just trying to describe an abnormal or medical condition, or it could be normal actually, a medical condition or anatomical condition through physiology. In this case, we want to do pathophysiology of respiration, which basically says we're going to take all the fundamental knowledge we just gained about anatomy and physiology related to the human system, the respiratory system, and bring it all together into one study of what could go wrong. So when we think about the pathophysiology of respiration, there are a few things we need to think about. The first is the nervous system. There are factors that can affect our nervous system. We already talked about chemoreceptors, and they monitor what? These receptors are thinking of oxygen levels, carbon dioxide, hydrogen ions, and pH of the cerebrospinal fluid. We already talked about that, right? We talked about that you have these receptors and how they work. We also talked about the hypoxic drive. We talked about the fact that they provide feedback to the respiratory centers to modify our rate of ventilation and our depth or breathing, right? So there's two types. There's the central chemoreceptors, and they're in the medulla, right? You should know where the medulla is. If you don't, look it up real quick. And those respond to elevated CO2 or a decrease of pH in the cerebrospinal fluid. It's pretty simple, right? Central chemoreceptors are in the medulla, and they respond to elevated or increased carbon dioxide or a decrease of pH levels in the cerebrospinal fluid. Those are our primary, going to be the first things that fire off what? They fire off a request to ventilate. And you should know about the phrenic nerves and all that at this point. The peripheral chemoreceptors, right? They're in the carotid arteries. They're also in the aortic arch, meaning that they're in your aorta. And they monitor for decreases in oxygen in the blood as well as low pH. So I'll let you think about what are those actually doing. Are those possibly the hypoxic drive? Is that how it happens? You should probably think about if that's the right answer or not. I would guess it is. If any of this impacted you, if any of this impacts you, if any of this happens in the nervous system, right? If any of these changes in CO2 or pH occur, the central chemoreceptors or the peripheral chemoreceptors see a decrease in oxygenation in the blood as well as low pH levels, then you're going to impact the respiration of the body, right? And it could be in a positive way. I'm not saying in a negative way, right? You're going to hopefully, this is going to kick off some form of request for ventilation. That starts the process of oxygenation, which leads to respiration. And we now know we have internal and external respiration. So, this is a kind of a walkthrough. I'm not going to go through all this. You should stop the video and be able to walk through this chart and understand how all of this works at this point, right? The exchange of oxygen at the alveoli level, how pulmonary circulation works, how systemic circulation works. You should understand how the respiratory control centers work and how they're telling the diaphragm to kick off, to contract, and what happens and what else happens, how inhalation, exhalation work. There's a ton of stuff here, the difference between external respiration and internal respiration, metabolic processes, a lot of stuff here. So pause it, walk through it, see how far you can get. What I do want to talk about is ventilation and perfusion mismatch. Now this sounds like a big thing, but ultimately here's the way this works. Let's go back to our cab example. And you are the cab driver of the hemoglobin, and you're coming in through the pulmonary artery into the lungs, and you eventually get down to the alveoli, and you are supposed to be picking up some oxygen. But the oxygen molecule is not there, and you're like, screw this, I got to keep going. I got people behind me, I got other hemoglobin, they're honking, they're blowing their horn, and you got to keep going. Right? So you're just like, hey, I'm out of here. Maybe you drop off a carbon dioxide molecule, but you as the driver of that hemoglobin molecule taxi, you're going to just go. At that point, we have a ventilation perfusion mismatch, right? What's happened is we've had ventilation, right? But for some reason, the oxygen molecule isn't arriving at the same time as the hemoglobin molecule. So you don't have a gas exchange. Right? And that leads to what? If the hemoglobin molecule doesn't have an oxygen molecule rider, what happens when that hemoglobin molecule goes all the way through the process, gets to a systemic circulation cell, and can diffusion occur? There's no oxygen molecule. Now, what did we always say? If the cell doesn't get what it wants, what happens? It starts to get pissed off, may die. So the important part here is to also understand the hemoglobin molecule may get really pissed and not even let the carbon dioxide molecule out of the car. And now it starts driving with this carbon dioxide molecule inside of the the hemoglobin molecule, and ultimately now you have an increase in carbon dioxide. All this kind of gas exchange and challenges with ventilation perfusion mismatch, everything I just described to you, basically the bottom line is you have to get the oxygen molecule to arrive at the right place at the right time for the hemoglobin molecule. And then the exchange has to take place. And if it doesn't, this is the early stages of hypoxemia, right? If the hemoglobin molecule doesn't have an oxygen molecule, and we talked about that means that hypoxemia is a result of there not being the appropriate level of oxygen in arterial blood, which if you leave that untreated, if we don't get the oxygen, that mismatch corrected, right, it will lead eventually to hypoxia, which means we don't have good perfusion. And that totally sucks, right? And you should now at this point understand that cascading effect. What happens when these processes don't all work together? We eventually end up at the cellular level without the right level of oxygen and the whole process that goes on with that, okay? So this is a good example, this is a good drawing to kind of get your head around ventilation perfusion mismatching. So if you look here, there's a couple things that can happen, right? On the left-hand side here, you have perfusion without ventilation, right? Which means that ultimately blood goes to parts of the lungs that do not have oxygen. And blood does not go to the parts of the lung that have oxygen, right? So you get this mismatch, and in any case, it's the early stages of hypoxemia, right? So we have to be really careful about realizing that, okay, if we're not getting the adequate amount of oxygen into the blood, we're going to eventually create a domino effect that leads to hypoxia, which ultimately leads to cell death, which leads to, obviously, challenges to tissues, organs, and eventually the organ systems and the organism, okay? And more than likely, what we're going to see that as is either a change in the respiratory rate, a change in things like cardiac perfusion and capillary refill, and all the other signs and things that we look for when we're doing our patient assessment, which we're not going to get into here. There are a whole bunch of things that can affect ventilation, right? So we need to be aware of these as we're thinking about dealing with a patient. So things like infections, allergic reactions, unresponsive patient due to an obstruction, interruptions to the peripheral or central nervous system, meaning the patient could be on prescribed medications that they're having an issue with. There could be an injury to one of those nervous systems, drugs. There could be too much carbon dioxide, hypercarbia. You need to know that term. Disease, right? Multiple MS or COPD. We could have allergies. We could have trauma to the head and spine. The tongue could be in the way. This is the most common challenge. Snoring is usually a sign that if you have an unresponsive patient, they're unconscious, and you hear snoring, they're not in respiratory arrest at that point, but you are impacting ventilation, which impacts oxygenation and respiration. So those are what we call intrinsic factors, right? These are things that are happening inside the body. Extrinsic factor are from outside the body. So this could be something that fractures the jaw, something that, you have a pneumothorax, you've been shot, the patient's had something go wrong, typically from a traumatic event. So you just need to know that both intrinsic and extrinsic factors can affect ventilation. Intrinsic is something that happens in the body. Know a few examples. Extrinsic, typically related to trauma. The fractured jaw one is really important because you could have a patient with a fractured jaw and you're not realizing that, hey, wait a minute, that's part of the upper airway, right? It's part of the oral cavity. And so that could be compromising their ability to ventilate or to bring in enough oxygen. They could be ventilating, not getting enough oxygen because it hurts when the jaw is fractured, which is then going to impact respiration. And if you can realize that early on, right, there's a great example of really understanding what happens in the body and understanding the impact of a trauma situation so that you can take corrective action and maybe get that patient on the appropriate oxygen therapy to try to maybe not reverse it, but minimize or prevent further deterioration of that patient. Respirations. You have two types of factors that can affect respirations, external, internal. External are environmental factors, right? And this is because you've limited the supply of oxygen. right? So things like atmospheric pressure, somebody's in a mine or they're at a high altitude, they have partial pressure, right? They don't have enough oxygen in the environment around them. There's carbon monoxide. We've talked about how it binds to hemoglobin, and this could create false pulse ox readings. So all of these are external factors. This is when you're looking around the environment, you're looking around the scene, you're trying to understand if there's something in the area, in the scene, that impacts this patient's ability to respirate appropriately, to get the level of oxygen the cells need. And the internal factors are going to be things that reduce the surface area for gas exchange. These are typically going to be medical conditions. This is now what we're talking about here when we're reducing the membrane, right? The ability for gas exchange is that we don't have a good way to do osmosis, or there's osmosis not occurring correctly. But in any case, all of this is going to be driven by some type of medical condition, which could be pneumonia, pulmonary edema, COPD, emphysema, what's known as intrapulmonary shunting, which is when blood bypasses the alveoli and returns to the heart without oxygen, which is basically a ventilation perfusion mismatch, right? Shunting, where we don't have the right amount of oxygen in our body. And we should already know that when that starts to occur, we don't have the right amount of oxygen in the arterial blood. That's going to lead to what? Hypoxemia, which is going to eventually, if not corrected, lead to hypoxia. So just know that there are external and internal factors that can affect respiration. Circulatory compromise. We started this whole conversation with the circulatory and respiratory systems have to work together. So there's going to be situations when they're not working optimally and perfusion is inadequate, that gas exchange is inadequate. And so this could be from trauma, right, that obstruct blood flow, right? So here, maybe the patient's ventilating correctly, maybe they are getting enough oxygen with each ventilation, but and the actual external respiration process, which you should know what that means now, is occurring, right? So you've got at least that ventilation, oxygenation, and respiration occurring, at least the external respiration, but you have some type of trauma or other issue, right, that doesn't allow the hemoglobin cab, if you will, loaded with oxygen, to get to where it's supposed to be. And that could be because of a bunch of stuff: pneumothorax, hemothorax, possibly an embolism. So there's a bunch of ways where, in that case, you're not going to get internal respiration, right? The systemic system is going to break down. So systemic circulation is going to break down, right? So you need to understand, is there something compromising the circulatory system, stopping that hemoglobin loaded with oxygen, the hemoglobin cab, to get to its destination? So you can also have medical disorders, right? Things like anemia, right, which reduces the amount of hemoglobin in the blood. So you need to know, hey, this patient's anemic. And in your mind, you should be like, oh my gosh, if they're anemic, they don't have a lot of cabs, right? They don't have a lot of hemoglobin cabs or hemoglobin molecules. Please don't go to your instructor and say, hey, there's no hemoglobin cabs, they're anemic. Point is, you have a reduction in hemoglobin. So that means that you ultimately aren't going to have enough oxygen molecules being able to bind to the hemoglobin. And in that situation, what do you have? You have a mismatch again, right? You still can ventilate, you can still get oxygen in the system, but there's no way to get that oxygen molecule, or you don't have ability to continually get the right levels. Now, this can be controlled, but knowing that a patient has anemia and now they have some other type of challenge or disorder to their system, you may need to take some other kind of oxygen. This also is important to know as you get into pulse oxes. And then shock, obviously. And shock, things like hypovolemic or vasodilatory shock can impact the circulation. So hypovolemic is the way your blood's, the volume of blood. Vasodilatory is how the dilation of your vasoconstrictor. The way your vasosystem, your vascular system, is managing dilation and constriction. You need to look up those two terms and understand them, because those two types of shock contribute heavily to circulatory compromise, or the integrity of your circulatory system. Obviously, blood loss. If you lose blood because of some form of trauma or internal bleeding, something, breakdown in the system, you are going to compromise the circulatory system. All of these ultimately have very similar come out to be the very similar type of challenge, right? You're ultimately thinking about, okay, is this impacting my ventilation, my oxygenation, or my respiration? For everything we talk about, and when we go to part 2 and you're doing your patient assessment, you're going to keep coming back to which one of those three are being impacted. And it can be all three, it could be 2 of the 3, or it could be 1 of the 3. But this is the cool stuff. Now you should really, really have this down, right? Here's a pop quiz for you. And hey, we've covered a ton of stuff. I'll let you go through this. There's some things we're going to cover in the second section, but there's a ton of stuff here that we have already covered. Point of this is, I'm hoping you picked up a bunch of stuff. In the second one, we're going to do patient assessment, suctioning, basic airways, oxygen delivery, and how to use ALS airway procedures, or how to support those. Look, at the end of the day, we're not going to get into, this again is going to be the academic side of it, but really hope that you're kind of seeing the coolness factor here, and that you've been able to at least start making some sense of this. And again, I beg of you to make sure you study the text, because ultimately the text is always right. Your instructors are always right when it comes to the academic and getting through the test and getting yourself to certify as an EMT. So with that, truly, truly hope and pray that this was helpful. Take care.